Now, the Eastern Cape is one of the worst provinces facing cases of medical negligence. During the 2023-2024 financial year, the Provincial Health Department paid about 350 million rand for medico claim cases. Malungelo Booi is in Mthatha and joins us live now. Malungelo, what do we know so far?
Well, I'll tell you this, Masichaba, we're live for you from Mthatha Hospital Complex. In this hospital complex, there's two hospitals or two health facilities that you will see. It's the Nelson Mandela Academic Hospital and also the Mthatha Regional Hospital. So these facilities are actually quite key for people here in the former Transkei region, because these hospitals, in fact, service people that are transferred from about 26 other health facilities here in the former Transkei region. Bear in mind, though, that this area of the former Transkei region is a predominantly rural space. The roads are bad and also the health facilities are far in between and people have to travel long distances. And when we're speaking to some people who know these issues of medical negligence claims in this particular province, and especially this part of the Eastern Cape, they'll tell you that this particular health facility or this complex, in fact, deals with a number of these cases here in the Eastern Cape. In fact, we know that there is an office in this facility that has been set up by the health department to deal with these particular cases, and it consists really of experts that scrutinizes each and every case that comes before them. I do want to bring in Sivuyile Mange. He's the chairperson for Denosa here in the Eastern Cape. Sir, thank you so much for your time. I'm really curious to know, how is it like? What do your members tell you? How it feels to work in an environment that is highly litigated?
Maybe let me start by saying, as you mentioned, that we are a rural province, and our province is one of the highly litigated province. Maybe it's because the province inherited two former homelands, sure, that is the Transkei and Ciskei, and as such, the province is under-resourced. And even in terms of infrastructure, there's infrastructure backlog, and even infrastructure in terms of roads, we are still having a challenge with that. Those are the contributing factors when it comes to this issue of litigation. It creates a ground for litigations. So our members who happen to be nurses in these healthcare facilities are facing such a situation and are under stress. And in delivering the services, they service people under stress because they fear these litigations. We know anything that has to do with the courts, it doesn't settle well with anyone.
One of the things that I think you said when I was having a chat with you about this is that people or nurses and doctors, instead of allowing women to give birth in a natural way, they then opt to go for C-section. Tell me more about that, why they opt for a C-section.
As I'm saying that most of the time these litigations are due to under-resource in terms of it's either human resource or otherwise. Sure. So that is why you find that healthcare workers may devise other means or options in terms of trying to opt for lesser risk. Because, for example, if you talk of a delivery, there are two ways. It's either it's a normal vertex delivery or through a cesarean section. And you know, with the normal vertex delivery, there are a lot of risk as compared to cesarean section. So a healthcare worker may opt for that one in terms of trying to minimize the risk in terms of delivery.
I need to squeeze in this question. Do you think these medical claims have become a money-making scheme, particularly in this province?
In nature, where there is a litigation, you talk of winning money. So definitely there are gaps or loose ends that are being exploited or taken advantage of by some lawyers. We are not saying all the lawyers, but there are some, and there's evidence to that because there were investigations that were made by the Department of Health in the province, and one of those lawyers was investigated and found to be doing these things that are milking the department, the money that is not even there, because even today we are complaining of budgetary constraint within the department. So this will collapse the healthcare system if there are no ways in terms of managing this.
So thank you so much for your time. Sivuyile Mange is Masitshaba, the chairperson for Denosa here in the Eastern Cape. I also think it's important then for me to tell you, Masitshaba, that since April this year, the department has paid about 95 million rands in terms of these medical claims.